board certified behavior analyst with Butterfly Effects. I'm also the associate director of the quality assurance department, and I have been with Butterfly Effects for the last 10 years and in BCBA for the last 12 years. Today, I'm here to talk with you a little bit about care coordination. What is it and why is it so important? Care coordination is really simply the personal interaction and collaboration and simply communication among members of a client's care team. So how is that defined? It can be defined as the deliberate organization of patient care activities between two or more participants, including the client, involved in a patient's care to facilitate the appropriate delivery of healthcare services. Organizing care involves marshaling of personnel and is often managed by the exchange of information among participants responsible for different aspects of the client's care. It's important to know that there's been a significant amount of research conducted, and this research indicates greater quality outcomes are accomplished when care coordination is present. So that's really important for us to know and to remember when we're creating our programming for our kiddos here at Butterfly Effects. At BE, it's essential that we provide the best ABA program we possibly can to assist our clients in gaining the maximum independence and highest quality of life possible. Therefore, care coordination is essential in that process. So what does care coordination look like? It can take place many different ways, many different modalities, and it can take place among many different providers. Most often in ABA, we tend to see providers such as speech and language pathologist, occupational therapist or physical therapist, diagnosing physicians, neurodevelopmental pediatricians, teachers or anyone on your child's IEP team, respite providers or even babysitters, mental health therapist or psychiatrist, and the list goes on for anyone who is providing care to your child. The coordination of care can occur in lots of different ways. For example, coordination of care might occur during your child's IEP meeting. It might occur over a phone call. It might occur in an in-person meeting, via email, etc. Any way that we can distribute and share information among care providers. Adaptive treatment modification sessions are actually an excellent way for coordination of care to occur. And a lot of the time, what that looks like is when a BCBA is present for these adaptive behavior modification sessions, there's an interchange of information between the BCBA and the parent on anything that has changed in the client's care team. So let's say maybe there's a new PCP, a new primary care physician. There's a new speech and language pathologist that comes on. Maybe there's someone new in the child's classroom. There's new information that's being disseminated. There might be a new goal that's being conducted with the SLP, for example. There might be a medication change that's occurring by the primary physician, and the parent is communicating that information with the BCBA. So sometimes a lot of the information that's exchanged during this adaptive behavior treatment modification sessions is really, really important and a very easy way to disseminate that information back and forth. Even further, sometimes some of our kiddos have particularly challenging times in certain situations. For example, doctor's visits or dentist visits where maladaptive or challenging behavior might occur. This is an excellent time to ask your BCBA to be present during those adaptive behavior treatment modification sessions so everybody on the care team can get together and collaborate on how we can make this particular situation easier and simpler and allow the client to gain access to skills they don't currently have. So the BCBA can come to a session, talk with, let's say they're having a tough time with the speech and language session. They're having aberrant behavior, challenging behavior during an SLP session. The SLP and the BCBA, as well as the parent and the technician, can collaborate on ways in which they can decrease that challenging behavior so the SLP can therefore work on increasing those new skills that we want to target. Additionally, it's also important to remember that the key components of care coordination include open lines of communication, that we're working towards common goals, that we're working towards problem-solving barriers for a client. For the example that we just talked about, problem behavior during the speech and language session. How are we going to jump over that hurdle so the kiddo can learn those skills that we need them to learn and decrease those skill deficit areas? And also, it's important to remember that all providers should be on the same page when we're talking about working towards a common discharge plan. And for some of our kiddos that we've just started services with, and they're just getting into the field and the world of ABA, that's not going to be something that happens for a long time. But it's really important to look and to have that discussion on what does that look like? What are the skills that we want our kiddos to learn so they're prepared for discharge? It's really important to get all the providers on the same plan, going towards the same direction. At Butterfly Effects, we do train our BCBAs on care coordination and best practice care coordination procedures. Part of these procedures is actually obtaining authorization from parents or guardians in order to coordinate care with other members of the care team. Additionally, insurance companies often request documentation on the presence of care coordination. In order to give our clients the best possible outcomes, care coordination is essential, and we look forward to working with you and your care team.